Hello my dear friends, I'm Dr. Vaishali Bharambe. I've been teaching anatomy for more than 25 years and I love it. Today we're going to talk about something very interesting, but something which is really needed by you, Cryptorchidism. Asked very often, a serious disorder for the child, means a lot. Come, let's discuss it. So Cryptorchidism, what does it mean? It means undescended testes, a condition in which one or both the testes fail to descend into the scrotum. Okay, so about 3% of the total number of live births involve a child with a cryptorchidism or undescended testes. So where is the testes then? If it's not there in the scrotum, where is it? If it's not there in the testes, it could be a completely undescended testes, in which case you can find it in the abdominal cavity. But if it is partially descended testes, then you can find it, say, at the deep inguinal ring, in the inguinal canal, in the superficial inguinal ring, just above the floor, bottom of the scrotum. You can find it anywhere along the path of descent. Okay, so that is completely undescended, partially undescended testes. Okay, so let's quickly run through the process of descent of testes because that matters to understanding cryptorchidism. So come, what happens? Now this here is the diaphragm, this here is the developing testes, and you can see how at the cranial end, at the upper end, it is suspended from the diaphragm. That means it's anchored to the diaphragm with the help of a suspensory ligament. There is no way testes can descend. It's attached at this point, suspended from the diaphragm. At its caudal end, at its lower end, the testis is attached with the help of an inguinal fold to the genital swellings, which are only tentatively, that's where the scrotum is going to develop. Within this inguinal fold, a fibromuscular band develops, which is called as the gubernaculum. What is it called? Gubernaculum. Okay. So now this gubernaculum at the upper end is attached to the testes, to the mesonephric duct, and to the peritoneum covering the testes. At the lower end, this gubernaculum has splits into a number of tails called tails of Lockwood. Through these tails, it gets attached to the bottom of the scrotum as seen here, or it also gets attached to the superficial perineal pouch, to the base of penis, to the saphenous opening of the thigh, sometimes even to the anterior superior iliac spine. So it's like a thread that has split and has gone to different places to get attached. How does it matter? Yes, it matters. Come. So now what happens one day? The suspensory ligament disappears. From being anchored to the diaphragm, the anchor is gone. Testes now are free to descend. Okay, so what happens? They begin to descend. As they descend, a process of peritoneum travels in front of them. This projection of peritoneum that leads the way for the testes is called processus vaginalis. And attaching the testes to the early scrotal swelling is the gubernaculum, right? So, slowly with time, this processus vaginalis regresses. The testes, as you can see, has reached the floor of the scrotum. It is attached in place with the help of scrotal ligament, and the processus vaginalis slowly disappears. Only a little bit of it remains distally as tunica vaginalis. This is the absolute basic of descent of testes. So it was present in the dorsal wall, suspended from the diaphragm by a suspensory ligament. It was covered by a layer of peritoneum called as the processus vaginalis, and it was anchored down to the scrotum with the help of gubernaculum. When the suspensory ligament disappears, the testes are free to descend down into the scrotum. Basic. Okay, but as they are descending, there is a timeline involved. At about the 4th month of intrauterine life, they can be found in the inguinal fossa or iliac fossa. In the 7th month, they can be found in the deep inguinal ring. Now see, they've started to traverse the inguinal canal in the 8th month. They reach the superficial inguinal ring at the end of 8th month, and in the 9th month, they manage to enter into the scrotum, or at the most at the end of 1 year post-birth, they will reach into the scrotum. This is the timeline, you must know it. Okay, fine. So now what are the factors that are causing it to descend? Why? Who is pushing it to descend down? The gubernaculum, which is shortening, pulling the testes down. The testosterone, the interstitial cells of Leydig begin to secrete testosterone, which acts as an androgenic drive, which pushes the testes to go down. The temperature in the abdomen is increasing, the pressure in the abdomen is increasing, that's pushing the testes down. Also, the fetal curvature slightly decreases, and as that happens, the testes are automatically pushed down along with the contraction of arched fibers of the inguinal canal. All this is pushing the testes down into the scrotum. Capped TG. I don't know if it helps you, use the mnemonic if it works for you. Right. So despite all these amazing methods, something can go wrong. And that something is what results in cryptorchidism. Testes may not descend. Okay. So causes of non-descent. So you saw that the testis has every reason to descend. Still sometimes it doesn't descend. What are the causes that prevent the descent of testes? Hormonal factors. Maybe the cells of Leydig are not secreting adequate amount of testosterone. Or maybe the testes want to descend, but there is something obstructing the way. The inguinal canal is not developed. There may be some kind of facial adhesions on the way, preventing the testes from descending. Or genetic abnormalities. If the person is a Klinefelter's, if the person is a Prader-Willi syndrome, then there are chances of non-descent. Maternal and environmental factors such as, she may just have a premature delivery. If she is delivered in the 7th month, what are the chances of testes having descended by then? Obviously, you are going to have undescended testes. Neurological factors. This is something asked in MCQs. Genitofemoral nerve has a strong influencer on the contraction of gubernaculum. If that nerve is impaired, you may not have gubernaculum pulling the testes down. So these are all causes of non-descent. Please read them again later. Idiopathic, no cause at all. How are you going to treat this child? This is a very crucial anomaly. You have to treat it. One thing is wait and watch. But before that, locate the testes. Where is the testis? If it's not there in the scrotum, first you need to find out where it is. On examination, can you find it in the inguinal canal? Can you find it at the superficial inguinal ring? That can be a possibility. If you can't find it, do ultrasonography, do an MRI, find out where is the testis. Next, is it a case of anorchia? So these are very rare cases, but is it that? Now, if it's not along all this, then where can it be? You remember I told you gubernaculum has variable attachments. So instead of passing along the path that led it to the scrotum, the testis, after it comes out the superficial inguinal ring, can go into the anterior abdominal wall. It can go at the base of the penis. It can go into the perineum. It can go into the femoral canal. It can go into the thigh. It can go to all these places. You can search for it there. If all this is done and you find the testes, you can wait it out. You can wait maybe until the end of the year. Maybe it will automatically descend. You can give some hormones like human chorionic gonadotrophin, which stimulates the descent of testes. You can do a surgical management. You can do what is called orchiopexy, wherein the testis is picked up from wherever it is and brought and anchored in the scrotum. Ideally performed between 6 months to 1 year, testes are mobilized and fixed in the scrotum. But does the story end there? No. You have to have a regular follow-up of that child. You have to see if the testes go into testicular cancer, because undescended testes are very prone to cancers. Right. What are the complications of cryptorchidism? Biggest complication, as you know, is infertility. I'm sure everybody is aware of it. The temperature to which the testis is subjected in the abdomen causes a person to produce infertile or immotile sperms. So infertility is a big problem. Increased risk of testicular cancer. In that malposition, testes can get twisted, causing testicular torsion. Associated inguinal hernia, of course, if the processus vaginalis has not fused, then there is always a chance of inguinal hernia. So now the question is, how do I go about writing an answer on cryptorchidism? So what we do is, first, define what is cryptorchidism, talk about complete and incomplete descent of testes. Now you explain the embryology of descent in brief, but you must be able to explain the descent of testes. Now talk about timeline of descent. Where is the testis in the 4th month, in the 7th month, and exactly when does it descend? Now talk about factors in the body that promote descent of testes. Talk about what are the causes that prevent testicular descent. You must have that visual idea. Okay? Then management and treatment, how will you treat it? And what are the possible complications if you do not catch the condition in time? Okay? So this helps you, this basic table will give you all the headings under which you can write an answer on cryptorchidism. If you need to know more about the development of the male reproductive system, please watch Development of Male Reproductive System Part 1 or Part 2. You can also watch the lecture 3, which is about development of external genitalia, males as well as female. There's also a lecture out there about embryology of hydrocele. Please do watch it to understand. These are all interrelated conditions. If you watch all of them together, your conceptual understanding of embryology of testes becomes very strong. So with this, I hope you enjoyed this lecture. I hope you learned a lot. Do like and subscribe to my channel. It will help me to make more of these educational videos for you, which give you information in a quick capsule with visual stimuli. I've also put up a lot of MCQs and notes on my website. You can go and access those there and use them for any further detailed study that you wish. So I'll see you in my next lecture, hopefully again on male reproductive system, because there's still some more to be done. I'll see you in my next lecture. Bye.